here. Get started today. This is a great event that we have planned for you today, great training that we have planned for you today. And we're looking forward to having the conversations with you that really will help us to learn with and from each other throughout today's conversation. And so thank you all for being here. Thank you all for seeing this as being of value to you in the state. We're really, really proud of the work that we put into trying to help make sure that this is the best kind of training experience that we can create for you. And so we thank you all for your investment with respect to that. I'm going to go ahead and share my screen. Hold on a moment so that we might be able to get started with this. And to let you know that we are here today with the second session of this training series. And it is our pleasure to be able to be here to present principles of community organization for the prevention workforce. We are really, really grateful that you all are here. We're hoping to make sure that we're going to be have everyone engaged in the conversation. We had a wonderful engagement last time around. And so just by way of having folks to get to know who's here in the room or the Zoom with us. If you wouldn't mind, in the chat, go ahead and put your name and the community that you serve and your organization. And if you don't mind, as a way of helping us to begin this conversation, a community organization effort that you've been involved with. Go ahead and put that in the chat. You can begin to populate the chat with that, and we'll see some of those and be able to highlight some of those as we have our conversations. But I want to start off by thanking the state for partnering with us to be able to provide this training series with you all. And so for our great friends at the Department of Services for Children, Youth, and Families, or as they are affectionately known as the Kids Department, to Rochelle and to Jonathan and to Christine, thank you for your leadership. Thank you for the support. Thank you for the guidance that you've offered throughout to help make sure that we're able to provide this opportunity for the prevention partners within the state to be able to learn and with and from each other with respect to that. And to that point, I think it'd be really important if we had at least an insight as to, from the state's perspective, a welcome and what is it that you see as being important as we conduct these series. And so, Jonathan, Rhodes, if you wouldn't mind, please share with us your thoughts. And thank you so much for your partnership, my friend. Look forward to our continued work together.
Absolutely, and thank you. I really appreciate that. Well, ladies and gentlemen, my name is Jonathan Rhodes. To start off, I am the Substance Abuse Block Grant Program Manager for the state of Delaware in prevention. I also have my partner in crime, my new partner in crime, Miss Christine Downey. She is my analyst, so it's truly a blessing to have her within our fold. To start off, we was talking about earlier about training, and everyone already know from me being out so long, I'm in the military, and I believe in one thing: training, effective training, appropriate training. And what we're trying to do on the state side is provide effective training for our providers so that we can be able to grow, build stronger bonds into the community, be able to obtain better partners so that we can be able to increase our effectiveness within the prevention community. So with that being said, Mr. Carlton Hall, and his partners, we are talking about doing future training as well as appropriate training, such as, we were talking about yesterday, Mr. Carlton Hall.
Yes. The cultural.
Yes, cultural. And we're seeing that after COVID, many folks have fell off a little bit, not within our providers, not with our partners, but in overall with other partners and other organizations, because, you get comfortable. We want to get rid of complacency. That's the main thing. We want to get rid of complacency and start getting people prepared so that they can have the tools to continue being prevention warriors within the community. Us partnering up with Carlton Hall Consulting, we feel that this will be the biggest chance for us to maintain and sustain the standards that we need to provide within our prevention community. And I truly thank Carlton Hall and his partners. I truly thank the providers who are on here who actually give a darn and wants to learn something. And I truly appreciate, the bonds that we have created and will be creating. So we want to build a strong partnership, build other strong partnerships with other partners within the community of prevention, and continue to thrive and strive so that we can take care of our children and our adults within the prevention world. That is all, Mr. Carlton Hall, and thank you. And like I said, the recording that I saw that y'all presented last time, the last meeting, amazing, pristine, on point. And I can't wait to see this meeting as well. So thank you and your partners, and I can't wait to, do more things with you in the future.
Jonathan, thank you so very, very much for those words and for that guidance and for the support that you've been providing throughout this process. We too appreciate the relationship and partnership. I also wanted to provide a quick opportunity, because it comes to my mind that others may be just on getting to know who your team is as well. And so, Christine, I think you had an opportunity to share a little bit last time, but if you wouldn't mind, please go ahead and reintroduce yourself and the role that you have there in the state, please.
Yes, so I am the newest member to Jonathan's team for the Sept grant program that we have here in Family Services with the Division of Children, Youth, and Families with the prevention team. My background is solely 3 decades of working with young children in the childcare atmosphere. I came on with the state in May as the administrative specialist, which most of you have engaged with me in that position. And just recently, last week, moved up into this position as the analyst for the team. So looking forward to, building these relationships, getting out and kind of getting back in touch with the youth in Delaware and going from there.
Christine, thank you so very, very much. Jonathan, thank you as well. And what we want to share is that as we are moving forward together with this, again, a lot of what it is that you're going to hear from us today is based upon the work and the experience that we have. However, we want to make sure that you know that the views, policies, positions that we're presenting do not necessarily represent those of the Substance Abuse and Mental Health Services Administration or SAMHSA or any of their federal grant funding source as we're providing this. Although I will share that much of what it is that you have is really in line with those expectations that they are communicating at the federal level as well as at the state level. I am thrilled to have what I would refer to as the Avengers of Prevention. And if I was Samuel L. Jackson's Nick Fury, I think I've put together a phenomenal team, which includes those that might be considered the superheroes in this field. Not the least of which is Dorothy Cheney, who will have an opportunity. You'll be able to hear from her in just a moment. She is the owner and CEO of Impact Solutions. She can correct me on that name of her organization when she has an opportunity to. But Dorothy has been providing coaching, training, technical assistance, prevention services throughout the country and internationally for as many years as We all have. I think we're all considered the elders in this field now. And I'll share it like that. But she wears it so well. You just go with it. You just don't know. Beyond that, you have Dave Clausen, who is an extraordinary prevention leader in his own right, has had national positions, is currently the owner and the CEO of DJC Solutions, who's providing great support to states across the nation, as well as some federal agencies. It is my great thrill to call him my partner in a number of endeavors that we do. And so thank you, Dave, for being here. And we also have another Dave Shavel, who I've known probably as long as I've been in this field of prevention. And he might say that he was here before I was. And so that proves to you that he's older than I am. and so he, but
older and wiser.
all of the above, all of the above. Not only one of the best prevention minds in our country, but also happens to be one of my closest friends in this field, has been able to move the needle in terms of the way we think about prevention in the nation. And so, Dave, it's an honor for you to be able to be here. That's the team that's going to be working with us throughout this training series. And we're going to be doing this because there's a new emphasis that we have on workforce development. And part of why it is that I'm excited that you all are here is because we are trying to do this and be thoughtful about how we do this. And so I'm going to ask and pose a question to all of you. We're going to be discussing community organization, but just very, very quickly in the chat, I'm only going to give about 10 seconds for this. Why organize? Why organize? So this is called community organization for the prevention workforce. What's the point? What's the relevance of this? Why organize? So put some of your thoughts in the chat, and Dave and Dorothy, if you begin to see them populate, if you can share with me kind of what it is that you see.
Share ideas, improve effectiveness, collaborative efforts, institutional knowledge. I love that one. People bring their knowledge with them and their skills. Focus the assets, the resources that we have. Thank you, Jeff.
Beautiful, 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 beautiful. Absolutely. And all of that is a part of the conversation that we're going to have today. But I want to just kind of lay the foundation for this and share with you that if we are serious about moving the population level needle, which is really what I believe the goals are. I'm a preventionist, and I believe three things as a preventionist. I believe that the most effective way of addressing any problem or any issue is to prevent that problem before it starts. I believe in the full engagement and empowerment of the community to be part of both solving that problem, but also understanding that problem. And I believe that we have to be guided by science in order to produce population level change. That's what it is that I believe at my core as a preventionist, and I believe that many of you share that regard. If that's going to happen, the involvement and the engagement, it is the second principle that I just mentioned, which is going to be where we're going to place our focus, because you cannot be effective and successful, as Jonathan was sharing earlier, without fully engaging the broader community in the conversation thoughtfully. Right? You're never going to be able to move the needle if it's just the 2 or 3 or 4 that you come and no more. If we're going to do this, we have to do this by engaging others. And so part of what it is that we are doing is working along this continuum of thought and ideas. We started off with a foundational conversation around prevention. We are now into some of the specifics, and these trainings are actually really very, very much aligned with what it takes in order to be a certified prevention specialist. And so many of our trainings fall right in line with the required domains within the certified prevention specialist requirements. And so we are going to speak about the principles of community organization today. We're going to come back in a few weeks and talk about planning and evaluation, look at principles of an environmental approach, and we're going to, yes, discuss what does it take in order to make sure they're able to stay in this long enough in order to be able to move that needle at the population level. And so we're hopeful that you will bring others to these training events. We're hopeful that you see the value in this. Please share with us your thoughts about how we might be able to do this and do this even better as we go through this. And so there's going to be an evaluation link that we're going to offer toward the end. Here's the conversation that we hope to be able to have with you today, looking at these steps of community organization, being able to apply those steps within a framework that helps us to be more effective as preventionists, looking at how we might be able to build our skills and engage in efforts to collaborate with other community partners and apply those lessons to the work that we are doing. Yes, we're going to have a bit of a conversation about what does equity have to do with our work and how that relates to what it is that we're doing, and hopefully provide an opportunity for us to listen, work with, think with, and learn from each other. Here's the agenda, and I'm going to stop sharing my screen because I'm going to pass the baton now. And Dave, remind me of who's going first. Is it you or Dorothy?
Dorothy.
Is it Dorothy? I thought so. So Dorothy, I'm passing the baton to you, my friend. Thank you so much for being here. And the floor is yours.
Awesome. Thank you. Thank you, Carlton, and thank you, team, and welcome, everyone. Thank you for the invitation and opportunity to be here. And I want to frame this as a conversation. So Carlton said that probably between the four of us, we've got, 5,000 years of prevention experience. So we've been there, done that. But you know what makes trainings rich and full is networking and discussing, especially when you're all from the same state and you have shared experiences. And so I encourage you, as we go through this content today, to please share your experiences, your questions, your knowledge, your thought. I love what Jonathan said as he framed the day about sort of the secret to success is providing effective training. So we're really here as facilitators of the discussion today. So I invite your thoughts and your knowledge as we go through it. So I want to start our conversation of community organizing by really setting the stage and defining it. And, there's no better way to define it than to ask you, what do you think should not be considered community organization? And you could just use the chat box for this. A, which would not be considered community organization? A, volunteering with a coalition. B, voting in election. C, attending a community town hall. Participating in a community cleanup. D, E, speak at a city council meeting. F, all of the above are community organizing. G, none of the above. I'll give you just a minute. See a lot of F's. F. I think we have consensus that it's F. I think so. Here's the thing. I'll tell you when Dave Shavel threw a little fly in the ointment there, didn't he? So here's the thing. I got to tell you, spoiler alert, whenever we give you a poll, there's really no wrong answer. So yes, all of the above are community organizing, and G, none of the above are community organizing. How does that work? Well, I'll tell you. Thinking about community organizing is really thinking about mobilizing the community. When I think about volunteering with a coalition, I feel like that's civic engagement or my own personal activism. And so voting in an election is being civic engagement. Attending a community town hall might be part of a broader movement. Participating in a community cleanup is me volunteering as part of a community mobilization effort. So yes and no, all of these are examples of community organizing, but they're also examples of how we as individuals get engaged in community organizing. So I want you to think about community organizing as individuals, but also on a broader level, mobilizing the community. And why is that really important? Because in order for us to get that population level change, like Carlton talked about, which is what we want to get to, we have to be engaged and active in our communities. But here's the thing. We're not going to do it alone. We have to mobilize our entire communities to also be mobilized and engaged and active. And that's where community organizing comes in. So what is community organizing? So community organizing is mobilizing the community for a cause. And that could be a cause like a local issue, like putting up a stop sign or passing a local ordinance. It could be a broad movement like social change. It could be around a cause. It could also be to exact revenge on those who've been bullying nerds.
Yeah.
It's about mobilizing a group to accomplish something. That's what community organizing is. So when we're thinking about ourselves and our own roles in our community, we're all engaged in our community. We want more people to be engaged. How do we sort of act as a force multiplier? By being strategic and intentional about organizing our community to achieve a common goal, whatever that goal is. So let's take a look.
I think the key point that you're going to make right here is that common goal. When you think about the poll we did, if you're speaking at a city council meeting for something you're interested in, that's not toward a common goal that people are organizing around. The key point of all the examples you just provided are what's that common goal that we're working to achieve as a group. We may have different reasons for being there, but we're still working toward that common goal.
Yeah, and I think there's really two big points to community organizing, Dave. So thank you for sharing that. One is it's collective action, right? And the second piece is it is a common goal. And so we need to take action on that. And we need to also have a process to be strategic and intentional for ultimately for us to tap into the power of community to make change. And when we think about any of the issues that we're working on, we're thinking about prevention. We're looking at preventing population level, rates of use among youth. Not one agency, not one individual, not one organization can do it alone. We have to come together in collaboration. And so to do that, we have to have a process. We have to know how to organize and ultimately change our community. You know, one of the things that I find really interesting, I've been in this field a minute, and we don't often refer to ourselves as community organizers. But in prevention, we are all community organizers. But you may hear it masked by different terms like capacity building or coalition building or community empowerment or engagement or cultural organizing. There are so many different ways to define and frame it, but they're all saying the same thing, that we need to act collectively around a common goal, tap into the power of the community in order to actually get that change in the community. And so that's what we're really talking about when we're talking about any of these concepts or terms. We're really talking about how do we organize the community. And thank you, Dave, for putting in that resource, the principles of community engagement. And, you know, I said we don't use the term, we often talk about capacity building or community mobilizing, but really are talking about organizing. And in prevention, we organize all the time. Think about all of the different groups that exist in your community or within your agency or coalition. It could be a youth-led initiative, or it could be an initiative around organizing a specific population or subpopulation. Or it could be organizing around increasing access to a program or around a specific ordinance. I'm working with a lot of communities right now that are focused on passing ordinances for emerging issues like Delta 8. They're coming together and they're mobilizing the community to create laws that are going to create a healthier, safer community for youth. And then ultimately, we also work to organize broad-based community coalitions, such as coalitions that come together at the macro level for the Drug-Free Community Support Program, or other broad coalitions that are looking at their data and that are looking at how to increase population health at the population level.
And Dorothy, we often get asked when we show this slide, do you need a coalition to do all of these things? And I'll give an answer and then you can respond is, you don't need a coalition, but you need people working together in whatever they call themselves, a task force, a committee, a work group, a coalition. The point of community organizing is bringing people together to start the SAD group and support the youth doing their activities, or to support the family service provider providing services to families, or to get that ordinance passed. We need a group coming together, whether we call it a coalition, a task force, a work group, a subcommittee. It's people coming together, work toward that common goal.
100%. Sometimes people don't like the term coalition. One of the things that I've done work with in coalitions is I'll call it a short-term action team or an action team. And we don't have to meet forever just to keep meeting. This group may come together, accomplish its goal, and then come back together when there's another issue to work on. Absolutely. There's a lot of different ways to frame it, but yeah, it's about collective action. Love it, Dave. Love it. We've been talking about benefits of community organizing, but a couple of things come to mind when I think about the work that we do. First of all, nothing about us without us, that we need to engage our community in the work that's being done. And it's going to bring us benefits because people own what they create, which is another central concept of community organizing, is that if people own it, they're going to be more engaged. They're going to be the power of change in the community. And it's also, if we bring the community together at the different levels, there's going to be more cohesion and buy-in. And here's the thing about community organizing. There's always going to be another problem to solve in our communities. And if we can create an infrastructure or a mechanism in our community to mobilize for change, we're going to be there for the next problem, because this is going to be a marathon, not a sprint. And so there's going to be so many benefits to the community if we can bring our communities together to solve problems.
And Dorothy, there were two comments we didn't get to before that are very appropriate here. Esther wrote, we can take better advantage of the resources that we all have on an ongoing basis, is what you're talking about. And then Dion wrote, so as not to duplicate services, pool resources, assist with sustainability and capacity building. When we do all this right, then it is sustained and it is capacity building. So I love those two comments.
Yeah, I also love that not duplicating efforts, because if there's one thing I hear, and it's in urban communities, it's in rural communities, is there's not enough resources to address the issues. And so we don't want to duplicate efforts, but by bringing our communities together and pooling our resources, we can really be that force multiplier in the community. I love that those comments. Thank you, Dave. So let me ask, does anybody have any idea what this means? You can use the chat box or you can unmute. FW, FW, FL, FH. Anybody know what this means? Dave, I'm having a hard time finding the chat box, so if you can see it and anybody says anything, if you could read it out, that'd be great.
Come on, folks. What do you think it means? This is the TikTok generation. You all surely know what this means.
If anybody does, they can teach the rest of the training.
Well, I'll tell you, it means fight, win, fight, lose, fight harder. Drum roll, please.
I love what Becca said. She said, I don't have TikTok.
Christine said, I couldn't type fast enough, but I have the inside scoop. Please. Indeed. Christine.
I'm dying to know what the inside scoop is.
What the inside scoop is. Amy says, I have TikTok and I don't know any of this. And Becca says, love that. So FW, fight, win, fight, lose, fight harder. I love this when I think about bringing our communities together or working in coalitions. It's a lot of work. And we're going to, Samantha Googled it and couldn't find it. So you
fight harder.
Well done, though. Well done. This actually comes out where I found it. I don't know where, but this actually comes out of a really great article in the University of Wisconsin, some community organizers, and they actually call it this. And the whole idea of this is that when we're organizing our communities, think about a coalition or a community group that you have been a part of. is it's, sometimes we have quick wins, and so we got to celebrate those, because we're going to have some quick wins and we're going to have some losses. And here's the thing, this is a marathon, not a sprint. So there's going to be moments when we are coming together and we're having victories, and then we're also going to have some losses that are going to take us to regroup and then fight even harder. And so at the heart of community organizing is we need to celebrate those small victories. We need to be in it for the long run. And the other really cool thing about looking at it through this lens is the process of bringing your community together and giving them the skills, the tools to actually fight in the long run is what really at its heart community organizing is all about. Now, I mentioned earlier that I know most of us have either been involved with coalitions or agencies or organizations or part of movements in our community. I'm just going to turn off the screen after I show this now. I would love to hear from you. We've just set the stage in defining what community organizing is and looking at a couple of examples. What are some examples of community organizing in your community? And what are some challenges in community organizing? I'm going to stop sharing and I'm going to ask folks if they'd be willing to share their screen or unmute. We would love to hear from you.
If you have something you can offer, please raise your hand and unmute.
We have 5 people here, if I got my introductions right. Becca, Jeff, Molly, Connie, and Holly from Courageous Hearts. So I would put you on the spot and ask, what aspect of the work that Courageous Hearts does would be related to community organizing? Is there such a thing, and anybody want to share?
While folks are thinking about it, I'm going to read what Christine said. So she said, sorry, I got bumped out. So you left us hanging. We were wondering what that was. Her professor in college used that FWFW a few weeks ago. She thought it was unusually unique, so she wrote it down. So love it. Thank you, Christine.
So Dave, could you mention the names again?
Oh, I just saw that Becca, Jeff, Molly, Connie, and Holly all are with Courageous Hearts. So I was wondering if you could share with us what aspect of Courageous Hearts would be in the line of community organization. I see Holly raising her hand. Take it away, Holly.
I've only started at Courageous Hearts. Maybe it's been about a month or so. Can you hear me okay?
Yes, you can.
Okay. And what I'm learning, just being a part of their community, they have a really connected community in the sense that everybody is respectful of one another, presents in a very friendly and professional manner, and everyone brings together their knowledge and puts it on the table. So we have a collective agency where we consider what the community needs. We all come from different parts of the state, and we offer what we have and we collaborate our thoughts. And now we are working towards learning about the community readiness. Mine, and for example, is in Rehoboth, but I'm learning also the community in Lincoln. And I'm also learning about what people are talking about in Milford. So when we come together, we're all, intelligent, individuals working towards a common goal.
I love that. I love the word, the language. So first of all, maybe you've just been with Courageous Hearts a minute, but you've nailed it. Let me just say, the words that you used, you talked about pooling knowledge. You talked about collective. And we often hear the term collective impact. That also is organizing for to achieve a goal. And you also use the word collaborate. Those are all sort of those key structural elements of community organizing. I also love that you talked about readiness, because part of community organizing is getting the community to understand and embrace the issue that we're working towards, whether it be passing an ordinance to limit alcohol outlet density, or whether it be a broader issue. It's about community readiness is at its heart, helping to get the community on board and aware so that they can be mobilized to action. The last thing I wanted to talk about or mention that you said, which was really brilliant, is you talked about getting to know each community. If you've ever been in a training with probably any of our team, you've heard one of us say, if you've seen one community, you've seen one community. And so while we need to organize, collectively, it's important for us to understand that what's happening in every community makes it unique. And so that's really at its heart, that community organizing piece is we need to get to know what's happening in each community as we mobilize to action. I love that. Thank you so much for allowing us to put you on the spot, Holly, and that great answer. I also just wanted to, there was a comment that I missed about an activity that had 300 people.
Yeah, that was Courageous Hearts.
Yes, thank you. That you just had a family fun day with 357 participants. I just wanted to acknowledge that because holy moly, that took some organizing.
Well, and what I was going to comment, it sounds like that was community organizing within community organizing, because you had to organize that event for that family fun day to engage those people, but as part of a broader effort to engage and bring resources to communities. So that's again, I'll say the complexity of community organizing when we're working toward a common cause.
And if I could just jump in, I'll just share that part of what it is that this conversation is really about is that there is a science to prevention, but there is also this art to community prevention. And a lot of what it is that we're discussing with respect to community organization has a lot to do with the art of how we might be able to get and engage and involve folks in a shared goal and option. And so in order to get 357 folks, there was a lot of artsmanship, I'm sure, that was involved with that, right? And so excellent.
And Esther sharing with us from LACC, I'm not sure what that is. In August 26th, we celebrated Opioid Awareness through CRT team in Del Castle Regional Park, and so many Delaware organizations were there sharing resources, making outreach, networking, and interacting with the community. It was amazing, which by definition, that's community organizing, bringing people together for a common cause to share resources. And Esther, if you want to add anything about that.
Yeah, Esther, unmute and introduce LACC to Dave. He needs to know that organization. LACC's in the house.
Yes, thank you. Good morning, everybody. Yes, it was amazing to see so many people just sharing a wonderful day over there, and everybody was just focused on the awareness against that and, sharing with the community. It was, very well. Thank you.
Thank you so much. Thank you so much.
So we talked about examples of successful community organizing. The second part of that question was what challenges exist in community organizing? I'd love to hear, especially when you're thinking about the event with 357 people or any of these successful events, but were there any challenges, or are there any challenges that you can think of when you're thinking about organizing the community?
Becca, you trying to unmute? I know you're on your phone.
Becca.
Hello, my name's Becca. I'm also with Courageous Hearts, and I just want to thank my awesome team, because without that amazing village, that amazing community event would not have happened. And there were so many moving parts that made that event happen. And I think one of the challenges of making that event happen was just making sure that we had the resources to get the event to happen. But I think one of the challenges that we came up against was reaching out to other community partners that we wanted to get involved. Like, for instance, like the local police department, trying to get some of the local some of the other local vendors to get involved. Getting people's buy-in at times can be difficult, especially when it comes to this issue. There is, as all of us are aware, there is a great stigma around addiction, and really it's so important about how we discuss it. And I really appreciate what was said in the beginning about prevention, because the first step to to acknowledging it, to preventing a problem is getting ahead of that problem. And so we had an event in July. We had a first Family Fun Day in July that that we were not able to get as many people to attend, and we came up against some challenges with getting people with attendance and everything. And so it really comes down to, how do we want to, I hate this word, market.
Yeah.
How do we want to market this, to the community? How do we make it attractive to the community? Thank you, Jeff. You're right. We do learn from our past. And so, and that was a great opportunity, because that allowed us. He is rolling over dying, Christine. You're right. He's in his office right now. Like, this chick is just cracking me up. But yeah, so that first event was a great teacher for our community, because it was like, okay, these are some of the teaching points that we can build on for the Family Fun Day event that is 5 weeks from now.
I love it.
Love that. You raise a really good. Thank you for sharing that. I'm
Thank
still
you,
amazed.
Becca.
I'm still amazed you had 357 people at your event. So you clearly learned from the past. But you raise a really good point when we're talking about, like, this issue in particular, like overdoses, or like substance use. There's stigma. We have to help find our agency partners to understand why it's important to them and how it's important to them. And so that is just a really important point, is how do we find that engaging partners? We often use the term, Becca, whiff them, what's in it for them? How do we help our partners recognize that they do have a horse in this race, right? That they do need to come to the table, and that we are all in it together. So I love that. That's amazing. Sounds like you've got an amazing team.
I do. We do. We have an amazing team. There is no I in team, right?
Love it. Samantha mentioned in challenges keeping people informed and engaged. And I think that's also another one as well, is how do we sort of keep people connected, and how do we keep them engaged in the work? I was reading an article recently about community organizing, and there was really two things that stood out for me. One is, and you'll often hear the amazing Carlton Hall talk about this, the power of why, is helping people identify why the issue is important to them and why they need to get involved, that issue of why. But the other piece of it is to keep people engaged, is not give them too many options, but like give them one or two tasks to do, and then support them in getting those tasks done so you can keep them engaged. Molly said something about staffing, supplies, and marketing, that word that Becca did not like. Marketing, how do we market it? I know. How do we get the word out? But staffing and supplies, even though we may have resources or may not, I love what Holly mentioned about pooling resources. That's at its heart one of the most important elements of bringing the community together and organizing, is pooling resources, because there's never going to be one agency or organization that can do it all. So love it. Other thoughts or challenges? There's some cool stuff going on in the chat box. Jeff says, I'm only joking. Everyone on this training has brought so much to move this cause forward. I love that. A rising tide floats all ships. Love that. And so, Jeff, we're turning it over to you to finish the rest of the session. So
Yes. The floor is
Isn't that
yours.
awesome? I'll tell you what, nothing, I don't know if I have an original thought, and that's why I put that about, you guys relaxing. You know what I mean? And when I put that about you guys relaxing, courageous hearts on site, I just wanted everybody to understand I'm only joking. Without you guys telling me something, I cannot bring that to the community, and left to my own devices, and only by my own devices, my ship's not floating. You know what I mean? So again, that's why I put that out there. It's, that the people that I've met as I've been working with Courageous Hearts and I've been out into the community and on these trainings and all that stuff, it's just, I think of you guys sometimes as just my private library, my private resource that I hear things, I learn things that now I'm able to go out into the community, and that's what makes us all successful. Right. I mean, it was nothing. I didn't wake up one day and had an event that brought 357 people to the property. That was not, and I think Becca put that very clearly as well. That wasn't something that I did. It is we. There is definitely not an I in team. So with that, guys, it's break time.
Thank you so much, buddy. Thank you so much, man.
Thank you.
Doggone, I'm going to have to bring out some daggone tissues. Take us forward, Dave.
Dave.
So this is a good transition, but I think we have a new definition of community organizing. It's a process, an organized process to raise all ships in the community, to raise the entire community.
I love that.
And so this is a good, when we talk about overcoming these obstacles or these challenges, it's really talking about the community organizing skills. And so that's what we want to talk about next. What skills do we need to overcome these challenges? Before we jump into the list that we have, there's a thing in training where you say, don't ask a question you don't know the answer to, but I'm going to ask a question here. What are some of those skills we need for community organizing? If you want to go ahead and put in the chat box, you've mentioned some of the skills that it will take to overcome these challenges. But what are some of the skills that you think are valuable to you or that are needed to be effective in our work to community organize or to organize a community? Anybody have any ideas of what skills we need? And we'll see how close we came to what you've identified. And listening skills, active listening seems to be consensus here.
Openness and curiosity.
Love that.
Love that. Asking the right questions. Yes. Communication. Project management. Yes, indeed, Molly.
What's interesting, I'm looking at the list and then the list that we have, I'll share it. We've identified these skills that you talk about can be threaded throughout the 5 that we've identified here. Determination, strategist, again, be thinking strategically. So what we'll do is we will, as we go through this, and this is a note to Carlton and Dorothy and I, is we'll interweave the skills you've identified as we walk through these organization skills that we've identified. This is for looking at research on what is effective community organization, what is community effectiveness, and looking at the work of coalition and groups, what makes them effective. So thank you for sharing your ideas. Be curious, not furious. I love that. How do we engage people? And that talks about actively engaging people. So we will weave these skills that you've identified as we walk through these 5 different organization skills. And it's really, again, just to summarize what we've got here, is building that common agenda vision. That's getting that ownership and buy-in among the partners. And you talked a lot about that, and that requires listening to the partners to see what they're interested in. We're going to go into each of these. Recruiting, and a key point here is retaining volunteers. How do we keep people interested? And the way we do that is through cultivation. Thank you, Esther. How do we do that to keep people involved? Facilitating groups means listening to people, and we'll talk about that. Establishing strategic alliances, that's a fancy way of saying building formal relationships among organization and individuals. That's really related to sustaining the efforts. And then we'll talk about, again, something that's thread throughout this is maintaining our focus on health equity. How do we make sure that we're engaging all in the community in a way that addresses any disparities that may be existing in our community? So we're going to go through each of these, and we'd love you to continue, and we thank you to continue your participation as we go through these. So the first one, before we get started in this, the one way we want to talk about these skills is we want to create a scenario, and we'll talk about the skills, and then we'll relate it back to the scenario. So the scenario we're going to walk through, there's a community condition that we've addressed the parents' attitudes toward drug use, the parents' caregivers lack up-to-date information on drugs and parenting skills to communicate with their children. So we've done an assessment of our community. We've identified what are the protective factors or the risk factors, and it's really around how do we empower parents to have good conversations with their children to set guidelines for what's acceptable, what's healthy behaviors in the family, what's healthy behaviors among the youth. So the way we're going to do that, reach out to parents, is to create a one-stop center for parents in multiple languages available online and via printed material. So a place where people can go physically and online to get information about parenting, about having conversations with their kids. And in this scenario, we have two lead organizations, the Hill Valley Drug-Free Community Coalition and the Hill Valley Family Services Center. So I just wanted to set this up to say, as we go through these 5 skills, we're going to look at them through the eyes of this community organizing effort. That makes sense? Are there any questions about the scenario that we're going to use to talk about the skills? But keep in mind, and as we go through, we'll walk through each of these in looking at this parent resource center that we're creating. So that first skill is community organizing skills. And this is what you talked about, is how we engage our partners. And the first thing, verbal, thank you, Christine, that you provide the best for families sometimes. Again, that's the kind of skills that we're going to build among our partners as we form this family resource center. So the first thing that we want to do is build a common agenda among our stakeholders. And the first part of that is asking, who are stakeholders in an effort, and how do we build this collaborative, this collective effort? And a way of looking at individuals and organizations is to identify who's impacted by an issue. So who are the people that, again, if it's parents and we're talking about talking to their kids, who are the parents who are concerned about drug use among their children? Who can impact the issue? Who has resources? Who has outreach to those who are impacted by the issue? What are the resources, and who has access to those resources? And who can advocate? So, I mean, who can speak effectively among the community or the people we're trying to impact with our strategies? So the first step of building this common agenda among stakeholders is to identify who those stakeholders are that we want to impact. And so, for example, in our example of this Parent Resource Center, if we look at who the stakeholders are, it could be the Hill Valley Drug-Free Coalition, the Hill Valley Family Services Center, the Hill Valley Police Department, the Hill Valley Latinx Network. What might be some other stakeholders, and I'm gonna be able to type in here, what might be some other stakeholders that would be interested in empowering parents to have conversations and address attitudes around drug use? Who might be some other stakeholders in our community? The Hill Valley Church. Thank you.
You can unmute yourself as well.
Who might be some other stakeholders? The schools, so the Hill Valley School District. We're going to pick on Hill Valley here. Okay, one more. We have room for one more here.
We got schools and university, Dave.
Okay, so Hill Valley U. And I'm going to say another one is the students themselves, Hill Valley Youth.
And another one that we got is hospitals and clinics.
Okay, the hospitals and clinics. So I'm going to put the school district, and you see where we're going with this. One is we've identified just the university, uni, and then the Hill Valley Hospital. We'll stop here. But you, again, in just 3 minutes of thinking, you've all identified 5, 6 different stakeholders that have a stake in addressing this issue of drug use and helping parents to identify. Now, the key point is, and this is, and again, the work that we've done, and this is related to collective impact, it's starting to think is, what is the frame or what is the interest that each of these groups, based on what they do, have in this topic of empowering parents to address favorable attitudes toward drug use? So we know the parents, the Hill Valley, the Drug-Free Coalition, their vision is they want parents to address drug use among their youth. They want to empower parents. The Hill Valley Family Service Center, their mission is really, and what their vision is, a decrease in family conflict. And so if we can work this in a way that decreases family conflict, that'll build the ownership of the Hill Valley Family Services Center. So I'm going to ask you, what is the police department? What might be their vision for this parent resource center that we're creating to reduce crimes? Thank you. Reduce crimes.
Reduction in self-harm.
Self-harm. And even domestic violence may be part of that crime. What the Latinx network, what might be their vision in this? Again, related to this parent resource center. Overcome language barriers.
And connecting. I love that.
Make that a little bit bigger. Okay, I'm just going to go through this. The Hill Valley Church, what might be their vision or what might be their agenda? When we say vision, we really need what is their common agenda? What might be the Hill Valley Church?
Community engagement or community connection.
Community connections.
Oh, I love this too. Esther said empower the families for the churches.
Well, you see where we're going with this. The whole point is, and this is part of building the ownership, is to not ask people to necessarily join on what our vision is, but to relate what they do so they can create a vision. And this is what Dorothy talked about, the WIFM, what's in it for me, so that when the police get involved, they know they're helping with this parent resource center, but they're doing it to reduce the crime. When the church gets involved, they're doing it not only to support the family parent resource center, but to create connections and empower families. And so they can talk about it in the work that they do. And this takes that skill that you talked about earlier in terms of listening. We need to listen to people, not tell them, here's why you need to join us, our group, but here's how what this group does that can support you in what you're interested in. And that requires us to listen to them to say, what are you interested in? What are the things that concern you? Here's how engaging and working on this parent resource center can support what you're doing.
I love that, Dave. I just want to go back to what Becca said, because Becca really talked about this when she was saying how to get all those partners on board and overcoming stigma, for example, and the issue that we're working to address. Part of our role in being effective community organizers is we facilitate that. The law enforcement may not initially see that if they really come to the table to address this issue, that they're going to see reductions in self-harm or crime. Part of our role as being effective community organizers is facilitating that process of helping these partners see why they have a stake in the issue that we're working toward. I love this, Dave.
Yeah, so again, this first skill is talking with our partners and establishing with them, how does your mission, how does your vision as an organization or an individual, how does that relate to what we're doing? In this case, it's the Parent Resource Center. Excellent, excellent. Other comments, questions about this building, this common vision or agenda among stakeholders? Okay, keeping us moving. The second step is recruiting and retaining volunteers. And I just, Carlton and Dorothy haven't seen this. I put an asterisk by volunteers because we've identified volunteers. We typically think of people who are coming in on their own, but each of these organizations is an essential potential volunteer. And so whether it's an individual or organization that's volunteering, and here's where that training comes in that Jonathan talked about. We need to provide volunteers, people who are working on our efforts, with the skills and resources so they can be successful. That can be, we're providing training. If we're going to, with our Family Resource Center, if we're going to be talking with parents and a volunteer comes in, they don't have experience talking with parents, let's give them the skills, the training, so they can be able to provide that resource, that service to parents. Volunteers these are things that volunteers can do. They can provide their knowledge to the community. We need to provide the opportunity for them to share their expertise, their knowledge of the community, share their resources. They can come in and make connections. They can advocate for policy change. So these are all the things that volunteers can do when they're involved in getting involved in it. And we can provide training and resources to support them in doing this. That will, again, need intern hours. Thank you, Dion. So again, what we can do if we're going to keep and retain them, we make sure that we provide opportunity to provide those resource hours. So taking it back to our example, the Parent Resource Center, if you were being asked to volunteer with the Parent Resource Center, what questions would you have? Again, you want to potentially give some of your time to volunteer. What questions do you have related to volunteering at the Parent Resource Center? If someone was asking you to volunteer, what questions would you have to them about your volunteering? How much time will it take?
How much time will it take?
Yeah, is this a lifetime commitment? So it's both time in any given day, and how long will this volunteering last? How much time will it take? That's Dorothy's asking. What is the focus? What will I be doing? What is the goal of this? And this is all about the communication. What is your mission? And do we stick to that? Thank you, Jeff. If I'm going to volunteer for one reason, yet you're really going to be going off and doing something else, that's not going to interest me. So are you going to stick to what you're doing? Thank you for that, Jeff. Excellent. And so in building and retaining volunteers, you're exactly what we need to provide. We need to ensure that we are getting a match between here's the roles that we have for volunteers and what skills they provide and what skills they need. So how do we provide them with the skills and the training? We want to provide personal invitation, meaning we want to connect with them and follow up with them individually to say, okay, you attended a meeting, did you get out of it what you wanted? Do you see a role for yourself? Provide the training and support, provide recognition for them. We all know that when people are recognized in some way, they feel better about their involvement. And then as a group, we want to share and celebrate results. These are all ways that we can build that level of commitment when we're making sure that their involvement is successful and we celebrate those successes. Provide skills, right, thank you for that, Dion. Provide a skills survey that says what skills do you have, what skills do you need to be successful in this, and then provide those skills. That's part of that training and support. So these are all ways, again, once we get people identified that, yes, this is something we want to get involved with, these are ways to enhance their involvement and retain their involvement. The third skill to acknowledge them. Thank you, Esther. Again, and there's lots of ways that we can acknowledge and recognize people for their support, whether it's a volunteer meeting at the end, whether it's a weekly or monthly newsletter that recognizes our volunteers, whether it's providing, there's lots of ways to provide support. And as Esther's saying, we need to be intentional about doing that on a regular basis. Thank you, Esther. So the third skill is community organizing skills. It's facilitating groups. And again, effective facilitation, if we do it correctly, we build ownership. People will feel a part of it. It encourages shared decision-making, meaning when people have a say in the decisions of an organization, the decisions of a group, that's going to build their ownership of it. When people, effective communication promotes teamwork. If people learn something and we do care about them, they're more likely to want to be involved. And again, if we're effective at facilitating groups, we can avoid conflicts in communication. And so I'm going to ask this again, if you are planning your first meeting of the stakeholder group, if we're going to build these things into our first meeting, what considerations will ensure an effective meeting? So again, if we're going to have a meeting of our Parent Resource Center and we're going to plan our first meeting, what are some of the things we can do that will build ownership, encourage shared decision-making, promoting teamwork? What considerations can we put into planning our first meeting?
And folks, if anybody wants to share audibly, you can unmute yourself.
I'm going to take what Dion said about public speaking,
Yeah.
for different audiences, is it's to know who's coming to that meeting, know who those individuals are, and know what their skills and interests are, so we can engage them ahead of time. If we know the police are coming, let's have the police give us a few-minute talk about what they're seeing in terms of crime related to families or youth involved with drugs. So let's look at who's coming. Let's make sure we have attainable or realistic goals. And Lisa's saying at the very beginning of the meeting, let's make sure these are the goals for the meeting. Just as Carlton identified the objectives of this training, let's be real clear about what are the goals of this meeting. Be well organized. Let's have an agenda for that meeting. That's another effective consideration for having an effective meeting.
Dave, I would also have it less formal since it's a parent resource center. Maybe have a community dinner, like a meet and greet, maybe have a few vendors that specialize in different kind of works and resources for parents there to share information, have on display some information of what we would like to have at the resource center, and have opportunities for them to sign up. They may want to be part of a work group to work with the little kids. They may want to work with the parents. So yeah, it's a great opportunity to you know, put the whole menu out there.
And again, and get their contact info. What you've identified, Dion, and Esther followed up with, a lot of times I've gone to meetings where you get excited, but there's no way to follow up. And so let's provide them with multiple opportunities to follow up. Do you want to join this committee? Do you want to go to this event? And again, at least of all, if you don't want to do any of that, let's at least get your contact information so we can follow up with you on other things we're doing. That's all talking about planning for a meeting. And this is a lot of words here, but you've identified probably half of what this list, and when afterwards you can get a copy of this PowerPoint, but it's really being thoughtful about who's coming to the meeting, what are our objectives, how can we effectively engage people? And these are all different ways, looking at the climate and the environment. You talked about having it informal for our first meeting with parents. If we're having a meeting and we're inviting community leaders, it may need to be more formal. So it's knowing our target audience and knowing how formal we need to be. Simply, what is the sign-in sheets, refreshments, AV? How do we engage them by using newsprint, by having ground rules? These are all different ways that we can be thoughtful about how we facilitate our meetings. And that's the third skill, and that's the group facilitation skill. So to keep us moving, the fourth one is establishing strategic alliances. And what this is about sustainability. We've talked about this a little bit already, but when we're asking organizations to share their resources or share their staff or share facilities, they may do it voluntarily at the start, but over the long term, if we want to keep their engagement, then we can start talking about strategic alliances. And this is mostly with organizations. And this is where we start to talk about MOUs, MOAs, or CIAs. These are the Memorandum of Understanding, Memorandum of Agreement, Coalition Involvement Agreements. But this is really formalizing the relationship we have with the organizations. So if we go back all the way back to our different stakeholders, it's one thing to get them at the table. It's another thing to start to say, great, you agree to this parent resource center, you think it's a value. If you think it's a value to the community, how can we sustain your effort? Let's form an agreement so you'll continue to commit your resources or commit your involvement over the long term. And then that's about sustainability. And so when we start talking about forming these agreements, it's about, again, this is a general agreement, but what is the organization? What is their level of involvement? What will they be doing? How will they benefit from partnering? What are some performance outcomes? What will result in, so we can make sure that we're meeting their need? What are these outcomes we want to achieve in partnering with this organization? And then some mechanism for renewing. If we're going to do an evaluation, say, were you successful in this? Did you get the benefits you wanted? Do you want to continue, or do you not want to continue? So again, just in any form of agreement, we want to consider including all of these things in that agreement, in that strategic alliance. So I would just ask a question of you all: why wouldn't an organization, so if we're going to ask the police department or the school district or the university to sign an MOU for the parent resource center, what might be some reasons they may not want to sign the MOU? Again, we're going to ask them to, and that MOU will include that they will identify staff that will continue to support and whatever resources they're providing.
Again, if you want to unmute yourself, you can go ahead and say it audibly instead of typing.
Well, you've already identified one in the previous comment. Somebody said, if the objectives aren't clear. So if they don't really know what the Parent Resource Center is about, they may not want to sign the MOU. Why else would an organization may not want to sign an MOU for a Parent Resource Center?
Dave, I found that when an organization doesn't see that the mission is relevant to their mission.
Yeah, and that goes back to the forming that common agenda and being real clear about what are the ways that this benefits your organization and benefits the Parent Resource Center. Be sure that, well, if it's against their or out of their statement of work. So is it within their mission and vision to be able, or their statement of work? Thank you, Esther. And so here's where we can negotiate with them and say, okay, what are the things you're doing? How does that fit? What aspects of your work does fit with this Parent Resource Center? So that's part of that communication that you talked about earlier on. Another thing that you mentioned earlier is the duration. How much time? What is the actual commitment that we're asking for? So these, again, they say a contract's only as good as the writing of the paper it's written on. So let's be real clear about what people are committing to this. Is it X hours a week? Is it X dollars? Is it X these meeting rooms that we're going to commit? Whatever it is, let's be clear about that. And then Lisa's talking about effective. How do we know it's going to be effective? Let's build our whatever evaluation we need into that agreement so we can say, are we meeting your goals? Are we meeting the Parent Resource Center's goals? Good. And so I'm going to turn over to Dorothy now, who is going to talk about the last of these skills, which is ensuring a health equity focus.
Thanks, Dave. And as I've been sort of taking notes as folks have been contributing, we've really already talked a lot about how to ensure that we've got an equity focus. And so when we're thinking about equity, that's really at the heart of the work that we do. And when I think about equity and community organizing, I sort of think about it on two levels. Is internally, we need to have a coalition or a group, whatever we call ourselves. As Dave said, it doesn't really matter, but that is representative of the population in our community. But we also then collectively need to strive toward equity, which is removing barriers to health. And we know that that exists in absolutely every one of our communities. And often it's at the heart of the work that we're trying to do. And I love what Esther said. I was writing down when I was thinking, Dave, when you asked the group for community organizing skills, they really talked about the skills that are really relevant to equity. Determination. We have to be determined. We need to be thoughtful and strategic about looking at our community through an equity lens. It requires project management, which means that we need to be organized and we need to be on track and we need to follow the science. I love that. And I love that 3 people identified listening. And so for part of us to really achieve equity, first we need to listen. We need to listen to perspectives and we need to engage them. And Esther, you talked about cultivating alliances. At the heart of all of those skills is really how we get to that equity piece. And so I really love, this is just one list of equity, it helps us understand the historical context. There are systemic infrastructure issues that are leading to health disparities in absolutely every one of our communities. It also really means about that we have to establish those relationships. We know all this. The one that really stands out to me here is we need to address organizational barriers. In order for us to address those barriers, we have to be open and see those barriers. And the only way that we're really going to see those barriers is by engaging the communities, the populations that are being impacted by those barriers. And I love this actual guide. It's from the CDC. It's a health equity guide. I always recommend it. There's so many wonderful steps and discussions and checklists for organizations or groups to be very strategic and thoughtful about building equity into the work at the community level.
And David shared that guide in the chat.
Love it. I knew he would. So let's go back to that Parent Resource Center. First of all, we would have to see that there are barriers that exist. but what might be some ways that we would address barriers for non-English speaking or non-literate adults in accessing the Parent Resource Center information? And let me just say, go ahead. No, go ahead.
I was going to just say, Esther works in this area all the time. I'm wondering if she might have some thought and some insight with respect to this.
Yeah, of course. For us, I mean, and for me as individual and so part of the Latin American Community Center, one of our goals is always like we receive a bunch of information, resources, activities, is complex. And the most important part of that is to be able to transmit, to inform to our community in their own language.
Yeah.
Because indeed it's a barrier. So sometimes, so many times, I should say, I encounter myself translating resources, if I'm going to participate as the event that I just shared with all of you guys. What I have done, I will continue doing that, is if I have this brochure, maybe I'm going to translate this brochure and you're going to see me just delivering them in both languages just to facilitate all the information for them. It's still the most, because we have so amazing information and resources, but, fortunately they are not in their own language. Mm-hmm.
I thank you for sharing that, Esther. I got to share a really quick example of health disparities. I served on the Board of Education in my community. I live in Wisconsin, in a very rural community where there's not a lot of diversity, and there are barriers. And we were doing an expulsion hearing, which is a formal hearing, and the student could speak English, but his parents could not speak English, and we had no translator. We had none of the legal documents in Spanish. And it was one of the most upsetting examples of health disparities that I'd ever witnessed, because our district didn't even recognize that there was a disparity there. And I will never forget that as long as I live, because we did the wrong thing in that example. We needed to be, but our district didn't even see the problem. And that also speaks to why we need to engage the community as we're building the work. Dave says it a lot, nothing about us without us is at the heart of that equity focus. Esther, thank you for sharing. Jeff said SAMHSA carries a lot of Spanish written materials. Yeah, we need to be very strategic about engaging populations in the work that we're doing. So I wanted to quickly go into community organization throughout the SPIF. And it's interesting, if you do a Google and just Google community organizing, you're going to see like the 8 phases, the 4 steps, the 10 steps, everybody's got a different take on community organizing. But you're going to see that they all sort of say the same thing. And the lens that we look through in our work for community organizing is the strategic prevention framework. So when you Google the 7 phases, the 10 steps, they're going to be very similar to this. They're going to be about looking at what the data is saying, building your capacity, be strategic about planning, include equity, and look through an equity lens, which is cultural competence, and that sustainability. So this is the lens that we look through as we're organizing our communities. Before I turn it back over to Dave, I've just got a couple of true or false check-ins. So as we've been talking about skills and community organizing, true or false, it is most important to build community organization during the capacity building step of the strategic prevention framework. So it goes assessment, capacity planning. True or false, it is most important to build community organization during the capacity building step. I'm going to say false. The community organization, it occurs, yes, it occurs at every step of the process. So it's really important to build capacity during the capacity building step, but we need to build capacity to plan. We need to build capacity. We need to organize at every element. In fact, if I had a magic wand, I would have capacity throughout the strategic prevention framework as a thread. Couple more. So
You said true, because it is true. We do need to build it in capacity and build it
absolutely,
to out. Yeah.
absolutely. Love it.
We're always going to throw in one trick question.
So, knowledge check. Select all the true statements. Community leaders who oppose a policy should be excluded from planning. Program participants should not be a part of the program evaluation. Asset mapping requires a map of the community. All of the above are true. None of the above are true. I'm going to throw it away here. None of the above are true. Let's see what we select all of the.
Jeff got it. Jeff got it.
Jeff got it. See, I told you, Jeff. This should be Jeff. Jeff should just be taking it over.
I'm saying.
No thanks, guys. It just goes to show how well of teaching you guys are capable of. So
Jeff wins the session today. One last one, and then I'm going to turn it over to Dave. True or false? And we've already answered this one. A community organization effort should move forward even if all key stakeholder groups have not signed a collaborative agreement. Holly says true. Holly, Esther says true. Jeff says true. And you're right. If you said false, you could also be right because, it depends. If we've got some groups that just don't want to sign on, then we want to move forward. But we also want to sort of unpack it. Why are they not signing on? Are they not signing on because the objectives are not clear? Are they not signing on because they think it's outside of their scope of work? So we need to unpack that one a little bit. So it really depends on why the stakeholders are not signing the agreement. The last thing I'll say, Dave, is I'm turning it over to you. When I first started working in the realm of community organizing, there was a community organizer said that one of the principles of community organizing is no permanent friends, no permanent enemies in community organizing. And so it's important for us to recognize when everybody has all the facts, there may be some people that won't sign on to this, and that's okay. They may sign on when we're working on another project, and we need to be transparent and welcome them when they're going to get on board. And with that, Dave, I'm going to turn it back over to you to take us through the spiff.
Yeah, and again, I'm noticing that we've got about just a little bit of time left. But what's exciting is we've talked about all of these. So I'm just walking through the strategic prevention framework. When we look at assessment, you all talked about the need to identify and talk to people to find out what resources already exist in our community. Before we can talk about duplicating resources, we need to identify what exists. And a good tool for that is asset mapping. And you can engage people in the asset mapping. That's a way to say what resources. When we do asset mapping, we're really looking about what's existing in our community. So in the assessment phase, we can engage people, and just by looking at what resources exist, just going through these. In capacity, we've talked about the need to identify stakeholders and identify who they are, what are their interests, and we can talk about different types of stakeholders, whether it's governmental leaders, organizational leaders, or informal leaders. We need to engage them and talk to them about what their interests are in whatever it is that we're organizing around. We can talk about in the planning phase, building ownership. We've talked about this. Use that resource assessment, that asset mapping to identify what resources. We talked about a collaborative decision-making. When people are involved in decisions, they're more likely to own their decision. Dorothy likes to say, people own what they create. If they're involved in the decision-making, they're going to own that. And we've talked about engaging people who are impacted, the diverse community in decision-making of our community. We talk about implementation. We talked about training and feedback loop. And this is related to raising the public awareness. Let's let the community know what we're doing. We've talked about this. I'm going through these, looking at our time. Evaluation, we've talked about engaging people. The key skill you talked about is listening, and that's really what participatory evaluation is about, is if we talk to stakeholders and listen to say what are they interested in and form our evaluation around what they're interested in, that'll be a much more effective evaluation. And then a key part of participatory evaluation is sharing results. And we've talked about that part of communication. Sustainability, if we do this and plan for the long term, if we form those strategic alliances, that'll ensure the sustainability of our efforts. And then we've also talked about cultural competence and lesson learned in terms of meeting people where they are at and engaging people in conversation to overcome some of those barriers that may exist. So again, this is a very quick way of saying when you do effective community organizing and engage in the skills we've talked about, they're applicable all the way through this thing we call the strategic prevention framework. So the last knowledge check we have for you, effective community organization is easy, true or false? And if you're thinking this is a trick question, Holly, how did you know that? It depends. Holly should have been teaching.
Holly picks up quick, man. Movie one, shame on you.
But I'm going to ask Holly, seriously, what does it mean? What does it depend on?
I guess it depends on everyone involved. Attitudes, coming together, making a mission, trying to work, and I guess putting all efforts in, putting your 100% in.
It's a building that what you're talking about is, thank you for that, is building that ownership among the people we're engaging, the people we're organizing. So it depends on how thoughtful we are about doing each of those skills that we've talked about. So thank you for that, Holly. Anybody else want to just talk about it depends? What makes community organization easy is really what we're talking about. Holly mentioned building those relationships. Anything else?
I think, Dave, in building those relationships, especially if you are doing a presentation to a group of stakeholders that you want to get their buy-in, is that you become familiar with the data. A lot of our programs are data-driven. Monitoring the future, we use their annual report to see where the trends are nationally and kind of align that with the data that we get on an annual basis from the University of Delaware as to what trends are happening in the state of Delaware. And when stakeholders, especially those who have resources, when they see the statistics are high, let's say marijuana use is high, it hasn't gone down in the last 4 years, that's a good buy-in opportunity. And then you can say what kind of strategies you can implement to lower that within the next year.
Excellent, Dion. And what you're talking about is using data to create that common and shared agenda. What do we all agree about this data? What do we all agree of our role in addressing this issue that we've identified? So thank you for that. That's part of that, building that stakeholder ownership. I love that. And with that, we've got just a few minutes left. I'm going to turn it back over to Carlton to wrap us up.
Dave, thank you so very, very much. I'm going to do 3 things rather quickly, but hopefully thoughtfully. The first thing I want to do is I want to thank the team that helped put this together. Could you help me with your reactions or just coming on screen and hand clapping? Could you help me thank Dave and Dorothy and Dave and the entire team, Christine, who's helped support us throughout this. Wonderful, 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 wonderful. Thank you for that. And what I'll also do is share with you that if that was oh, here we go. I knew that was going to happen. Sorry about that, folks. I thought I shortcut.
This is your summary.
I thought I shortcut. Yeah. You learned all this stuff. And with that, if you are serious about that applause that you just offered, please share this with those of your team that should be also getting this information. We ask that you invite them to the next session, which will be on October 24th, and where we're going to go into planning and evaluation. So a deeper dive with respect to that. I've been really, really thankful for your involvement and your energy that you brought, for your intellect that you've brought to this, and the wealth of your experience. So thank you, Dion. Thank you, Holly. Thank you, Becca. Thank you, Christine. Thank you, Jeff. Thank you all for contributing to the session and making it as rich as it is. I want you to take out your cell phones if you can. And Dave Closson is going to put in the link if you can't do this, but this will take you to our evaluation, which is very important for us. It only take a few moments, you know this. It only take a few moments, but it's very, very important for us to be able to get that. So please go ahead and get the link to the evaluation so that we can put that report together. That is connected to our ability to be able to provide you with a copy of the PowerPoint and a copy of, an access to the video link that you will all receive. So you all will receive notification. You can reach out to Christine for that sometime after the training, but we need you to provide your input to those evaluations. So thank you for all of that. This is our information, and thank you again for all of that. And with that, hopefully you got that up. Hey, Esther, what's going on? Give Major a hug for me, and let him know that we said hey, and everybody else. Dion, thank you for your leadership. Thank you for all that you do. And is Amy, Amy, are you still around? If Amy is around, thank you, Amy, for everything that you do at the state as well. Is there anything that you want to offer with respect to the work that you're doing there at the state, and anything that might be important and relevant for these folks as well?
The only thing I would mention that's relevant is I'm the person that does all the reporting to our feds, so we stay in compliance. And so when you get asked questions about invoices and things of that nature, that's why I'm the person that does that. But I did make sure that everyone knew that we were going through some of these trainings with our workforce development and build, staff turnover, building things up. And I appreciate everyone being here and me listening, and for everyone that answers questions multiple times. That's why it kind of keeps us in compliance.
Thank you, Amy.
Thank you all.
An extraordinary resource for the state as well. Christine, you have the last word. Thank you all very, very much.
Last words for me is I'm very thankful to be a part of this team. Make sure you are checking your spam boxes. If you do not see the notifications coming from us or from Carlton Hall, just to make sure that you're getting it. But as always, I am here every day. I am welcoming your phone calls, questions, and emails. I am here if you need me. Thanks, everyone.